Today's topic is healthcare associated infections. Those who have the textbook, please mention the page number in the chat box. So healthcare associated infections, there are majorly four. They are CAUTI, CLABSI, VAP, and SSI. Catheter associated urinary tract infection, central line associated bloodstream infection, ventilator associated pneumonia, surgical site infection. Okay. So these are the four main healthcare associated infections that patients get while they are receiving healthcare or even after discharge. So after receiving healthcare as well, if they get these infection, we relate it, okay, to healthcare associated infections. Okay. So this is preventable. Majority of these four infections, they are preventable and they are also a threat to patient safety. Bacterial or fungal pathogens can also cause this infection. It can cause antimicrobial resistance because if it is bacterial, the reason was a bacteria or fungi, and you're using antimicrobials for it, antibiotics for it, it can over a time it can lead to antibiotic resistance as well. Okay. There are other different types of healthcare associated infections as well, but these are the most common ones. Okay. So first is CAUTI, catheter-associated urinary tract infection. So here, uh, just a second. So when a urinary catheter is not put on correctly while inserting it in the catheter, if it was not inserted correctly or aseptic technique was not used while inserting the catheter, or maybe the duration on throughout which the catheter was inserted, but it was not kept hygienic, it was not kept clean, catheter care was not given, okay, or if it was left in the patient for way too long, okay. There are specific time intervals depending on the material of the catheter, the type of the catheter, based on which it has to be removed, okay, weekly once, okay, or once in 2 weeks, based on the material which is used in the catheter. Okay, so it has to be removed. Otherwise, the infection will not just stay at the urethra, it can travel up through the bladder, through the ureters, it can reach up to the kidneys as well. Okay, so that's CAUTI, catheter associated urinary tract infection. It accounts for approximately 40% of all hospital acquired infection annually. Okay, with fully 80% of these hospital-acquired urinary tract infection that are attributable to indwelling urethral catheters. Indwelling urethral catheters means the catheter which you have inserted and it stays there. Okay, not the intermittent catheter which only for urinating you will put in and the patient urinates, or quantum catheters in which the catheter is is linked to a condom and only while urinating it is used and then it is removed. Okay, so indwelling catheter, it's not like that. You place it, it stays there on into the patient's urethra for a few days. Okay, maybe a week or so. It stays there, and majority of the urinary tract infections CAUTI, catheter-associated urinary tract infections, it surfaces from the indwelling urethral catheters. Okay. So indications of catheterization, in which cases should catheterization done? Not for all patients you will put them on catheter, okay? So in which cases catheterization is indicated? So indwelling catheter is placed only when it is indicated, and it should be removed as soon as possible, okay? And patients who are on prolonged immobilization, maybe they have multiple organ failure, or they had a multiple traumatic injuries, multiple fractures, because of which they are immobilized. Okay, they cannot move. They cannot go to the washroom and do their business. In that situation, catheterization is recommended. Okay, short-term management of incontinence, that is usually in senior citizens, senior patients, they are not able to control their urination. They do not have urethral control. In that cases, short-term management is done through catheterization. To measure the exact urine output, specifically for patients who are like nephrology patients and all, who come under the kidney care, transplant patients, dialysis patients. Okay, in these patients, we need the exact amount of urine output. So based on that, the water intake or fluid intake can be calculated. Okay, so in that situations as well, catheterization is done. Then treatment of bladder outlet obstruction. So treatment of bladder outlet, like if there is any stones, okay, is there in the uh, that is obstructing the flow of urine, or maybe there could be some tumors, okay, growing into the bladder or into the ureter, which is causing obstruction. So to treat that, catheterization will be recommended. Then post-operative management with impaired bladder function, especially if a bladder surgery has been done or a nephrology surgery have been done. Soon after that, the patient will be under catheterization for a few days. Okay. So recommendations to prevent CAUTI, how can you prevent it? The person who is inserting the catheter is highly on them. Okay, it is highly dependent on the asepsis of the catheter placement. Okay, so focusing on personal hygiene, the person who is putting the catheter, that staff, okay, their hand hygiene, are they wearing all the required PPE? Are they following the aseptic technique of insertion? Okay, that is important. Catheter use, how frequently the catheter is being changed, or if it is kept placed in one position for a very long time, or metal care if it has been given to the patient or not. Okay, or urethral care is given to the patient or not. Hand hygiene, very important. Very simple, but a single most effective solution to prevent any form of hospital-acquired infection is hand hygiene. Okay, 5 moments of hand hygiene has to be followed during, before, after, okay, the catheterization procedure. And catheter insertion technique, strict asepsis has to be followed. If at all there is any break in the aseptic procedure, the instruments, the materials should be discarded. New one has to be replaced. New sterile articles should be replaced. Okay. Then closed system drainage. If you want to collect some samples from the catheter, okay, closed system drainage is used, and it should not be opened unless and until it is absolutely necessary. Okay. Until and unless it is absolutely necessary, do not open the closed system drainage. Replace the catheter and catheter collecting system. Replace the catheter and catheter collecting system. If at all you know there was a break in the aseptic technique, or you find there is some leakage Okay, immediately replace the catheter collecting system. Continuous irrigation of bladder with antimicrobials should be avoided. Otherwise, antibiotic resistance will develop. Okay, just to prevent the UTI, some healthcare personnel will continuously irrigate the bladder through catheter. They will send antimicrobials into the bladder to prevent any infection, but that can further deteriorate the condition. Okay, the person may develop antibiotic resistance to those antimicrobials. That has to be avoided. Unnecessary irrigation should not be done. Use distal end of the catheter or sampling port, okay, to collect the urine sample. The distal end, not the nearest point. Unobstructed urinary flow should be maintained always. If at all there is any obstruction in the drainage system of the catheter, immediately the drainage system has to be removed. It has to be replaced. No obstruction should be there. Meatal care is using antiseptic agents at the meatus area. Meatus is the area where catheter is being inserted into the urethra. Okay, meatus is the final outlet through which the urine comes out. Okay, that is the meatus area. So that area has to be cleaned with proper antiseptic solutions. That is the meatal care. So this is how the entire drainage, the catheter collection system looks like. So this is the needleless urine specimen port from where urine samples can be collected. It is the distal end. Okay. Then coming to surgical site infection. Surgical site infection is an infection that occurs soon after surgery. And also we'll just discuss briefly about some signs and symptoms of CAUTI. There would be burning pain, okay, in the lower abdomen, below the stomach. The patient may have some pain. Fever will be there, okay. And when the patient pees after discharge, maybe they have a burning sensation, and they are going to the washroom more frequently than usual. That's a sign for UTI, okay. The more you use a catheter, the greater is the risk for getting UTI. If you place the catheter for a very long duration, higher is the risk of developing CAUTI. Okay. So if at all any patient is on a long-term catheter, the catheter has to be cleaned. Okay, they should not touch the catheter with dirty hands. Always touch the catheter with clean hands after hand washing. And always remember the position of the urinary bag. If they're like the patients, even with catheter, they they walk around to get some physical activity. So they have to remember the urinary bag should always be below the level of their bladder. Okay. Above the hips, above the pelvis, they should never bring the bag, the urinary bag. Okay. They should not pull the tubing at all, twist or bend the catheter tubing. Avoid that. Coming to surgical site infection. So surgical site infection occurs soon after surgery. in a body part where the surgery was performed. Okay, only that area. It's not like a surgery was done in the hand and you got stomach flu. There is no relation. Okay, so where the surgery was done at that particular site, infection will start. So that is what we call a surgical site infection. Okay, there are three different types of surgical site infection. One is superficial incision, surgical site infection. It is superficial infection, okay, on the epidermal layer or maybe on the dermis layer, okay, not beyond that. Deep incision, here the muscles are also affected, okay, not just the upper layer, but also the muscle layer gets also infected. Organ or space beyond the muscles, the organs can get infected. The entire system can get infected, okay, because of a surgery. That is organ and space surgical site infection. So these are the three different types of surgical site infection. So source of pathogens, from where does this pathogens come and cause infection where surgery was done? First source is endogenous flora. Okay, that is, we all have pathogens, bacteria, fungi, microbes on our skin. That is normal to us. Okay, but these pathogens should be on top of the skin. They should not enter, they should not cross the skin barrier and get inside our body. Okay, they are normal because we can manage them because they are on our skin. They are not inside our body. So sometimes this endogenous flora from the patient's skin may get inside the organs, inside the mucous membrane or on the mucous membrane, and that can cause infection. Okay. We have some bacteria which are inside our body. They are supposed to be inside the body. Some bacteria that are on top of our skin, they are supposed to be on top of the skin. If they exchange their position, that could lead to some disease condition. Okay. Then Staphylococcus aureus. So from exogenous environment, patient skin, mucous membrane, from these environment, Staphylococcus aureus infection can develop. Okay. So because Staphylococcus aureus, usually they stay on our mucous membrane. Okay, every one of us will have some strains of Staphylococcus aureus in our mucus, in our nose, in our nostrils. Okay. So but if there are too much of strains of Staphylococcus aureus getting inside our skin, getting inside our mucous membrane from outside, okay, that could lead to infection. And during the surgery, if a prosthesis or any implant was placed on the patient's body, inside the patient's body, but if the prosthesis or the implant was not sterilized properly, okay, that could lead to infection. Or maybe it was still sterilized properly, but it was not handled in an aseptic manner. Okay, the personnel, the staff, the surgeons, okay, involved in that surgery, they didn't handle the sterile prosthesis or implant properly, and aseptic technique was broken. Okay, that could lead to infection in the patient. So these are the sources of pathogens. Coming to the classification of surgical wounds, you have clean wound. Clean wound has no infection, no inflammation. It's usually a surgical incision that we do. We consider that as a clean wound. That is also a wound. To do a surgery, you have to create a wound on the patient's skin. Okay, but that is clean because it's cut. Okay, it's not lacerated, it's cut in a way that causes no infection, no inflammation. Proper closure will be there. Okay, and there is no risk of any infection. And then we have clean contaminated. Again, this could be a surgical incision, but the surgical incision was done in certain organs which already carry some microbes, like your intestine, your stomach, your intestine, your appendix, okay, liver. Some microorganisms do stay here already. They are supposed to be inside the intestine, but when a surgery was done, incision was done, these microbes came outside the intestine or outside the stomach or outside the appendix, and they spread everywhere near the perineum. Okay. or in the hollow areas of the stomach. That could lead to infection. So that is clean contaminated, but still the patient is contaminated with their own bacteria. It's not from outside. Okay. Then contaminated infections or contaminated surgical wound from accidents, open wound, which you got from outside, maybe through a traumatic injury, road traffic accidents. Okay. And there was a gross spillage of your GI tract contents into the peritoneum. Okay. Maybe it was a rupture in the GI tract. Okay. Maybe the appendix ruptured, something like that, in which the contents of the GI tract, along with the microbes, it spread throughout your peritoneum. Okay. That could lead to contaminated wound. Then dirty wound from outside tissues, okay, traumatic wound, existing infection, perforation, wounds that was not cleaned properly, okay. Even before any surgical procedure was done, it was already infected. Organisms were already there. Septic wound, okay. That is dirty wound. So these are the different classifications of wound. So wound infection, an infected wound is a wound that bacteria or other microorganisms have colonized, causing either a delay in healing of the wound or deteriorating of the wound. So an infected wound is a wound that bacteria or other microorganisms have colonized, causing either a delay in healing of the wound or deterioration of the wound. Okay, because when a wound is infected, it will not heal at the right time. It will take more time to heal, or the wound may spread. Okay, maybe it was just a 5 centimeter long wound. After infection, it became 7 centimeter. Okay, that is deterioration of the wound. There is more pus, okay, and exudates that comes out of that oozes out of the wound. Okay, and your body's natural immune system, natural defenses are not able to tackle this level of infection. That is a wound infection. So contamination means there are pathogens, there are microbes on the surface of your skin or a wound. That is contamination. We call it as a contaminated area. Okay. Colonization is contamination is just the presence, but in colonization, they have started multiplying. The existing number of pathogens, they have started multiplying significantly. So much so that your body's immune system is overwhelmed. They are not able to bring down the infection. That is colonization. That is the difference between contamination and colonization. Contamination means pathogens are present. Okay, even right now, you go out and come, you spend your entire day out and come home, you have a contamination over your body. It's normal, it's skin. Okay, but when you take a bath, you follow your personal hygiene. Okay, these pathogens are not multiplying, they are not spreading. You have tackled it. But in colonization, they are spreading, they are multiplying. Okay. So bioburden, what is bioburden? Bioburden is the number of contaminating microbes that are present on the surface of the wound. Here, the wound swab is usually taken. You take the wound swab, give it to the microbiology department, and they will give you the exact number of different types of pathogens that are present on that wound. Okay. The list of how many pathogens are right now present on the wound. Okay. Maybe the infection is not caused by just one pathogen. There are some n number of pathogens that are infecting the same wound. Okay, so to get that number, that is what we call as bioburden. It could be a mix of bacterial, fungal, viral. Okay, so what is biofilm? Biofilm is kind of a transparent, translucent, whitish um, exudate. Okay, that protects the bacteria. So you can see here this green dot on the left, a small colony of microbes have formed. Okay. Now they have started to multiply. They have started to multiply. Here you can see the small colony is increased in number. Okay. And at last you can see here, they are still increasing in number, but they are covered with some transparent, translucent sheath. Okay. This is a biofilm. This transparent, translucent sheath is a biofilm, kind of an exudate. And this biofilm is protecting these microbes. When you apply antiseptic cream over, the antiseptic cream is not able to reach till the microbes crossing this thin white layer. Okay, so that is a biofilm. It actually protects the microbes from the defenses of the host, from your own blood cells, white blood cells. Okay, from the antiseptic cream that you're applying. Okay, this biofilm is protecting the microbes so that the microbes can still flourish and grow and spread and cause more infection. So it has to be scrubbed off. This white exudate you will see in wound dressing and all, diabetic food dressing and all, whatever that white colored exudate is there, doctors will remove it. Okay, they will scrape it off. They will rub it, take it off. It has to be taken off because it has a lot of microbes within it. Okay. You do not want this protective layer to help microbes grow further, flourish further. Coming to the local indicators of wound infection, you have redness wherever the wound infection is there. Okay. Soon after the surgery, as a nurse, you can start observing these areas. Okay. In post-operative ward, you have to keep an eye out for these signs and symptoms. Okay. Redness, increased exudate, changes in the exudate color, malodor, localized pain, localized heat. When you touch that area, it is warmer as compared to other parts of the body. Okay. Delayed healing. The wound is not healing properly. It's taking longer time. Wound breakdown. A small wound has spread now. It is a bigger wound now. Okay. Exudate is the pus formation. Okay. Earlier it was just a transparent fluid that is coming, but now it is whitish, yellowish in color. Which color also has changed. Smelly. It is very smelly as well. It smells bad. Okay. So these are the signs of wound infection. So as a systemic level at an overall level, what difference you will see in the patient? So patient's temperature will increase. Okay. There is a systemic increase in temperature. General malaise, that is the patient will be very weak, tired. When you do the blood test, whenever you have an infection, naturally your WBC count will go high. Okay. So whenever the leukocyte count is high means your body is tackling an infection. Lymphangitis, wherever the wound is there, okay, maybe in the stomach, in the neck area, wherever the wound is there, the lymph nodes near that wound are inflamed, swollen. Okay. So you can do a wound culture swab also to confirm the infection. Okay, a swab from the wound can be taken, given to the microbiology department. They will do the microscopy and find out what bacteria is causing the infection. So surgical site infection can be confirmed with the laboratory report. Okay. So prevention strategies. When you prepare the patient, you have to give them proper bath. Antiseptic soaps or solutions should be used to prepare the patient before surgery. Antimicrobial prophylaxis has to be started 1 hour before the surgery starts. Usually 1 hour before the surgery starts, antimicrobial prophylaxis is started if it is indicated. Okay. Through IV it is given. Okay. Then microbial sampling should be done after the surgery. The wound swab has to be done. Cleaning and disinfection, proper cleaning of the wound, proper disinfection of the equipments used in wound dressing, surgical instruments also, proper disinfection, sterilization has to be done. Aseptic technique and surgical technique should follow asepsis. Do not break the asepsis. Do not put the patient's life at risk with that. Sterilization of the surgical instrument is must. You cannot ignore that. Surgical attire and drapes also should be sterile, that the doctors wear, the surgeons wear during surgery. Post-operative incision care should be done after the surgery. The wound care, incision care proper antiseptic solutions. Okay, look, nurses keeping an eye out for signs and symptoms, initial signs and symptoms of surgical site infection. And those all things will come under post-operative incision care. Then surveillance system report each and every surgical site infection that has happened should be reported, should be documented and reported. So today we will stop the class here.